Good morning, everyone. For those that are joining us through YouTube, we will be getting started here in about 5 minutes. So if you could please just hang tight for us, we'll get going here soon. Good morning, everyone. People are continuing to gather. We will go ahead and get started here momentarily. Thank you so much for your patience. All right, we will go ahead and get us started here slowly. I do still see that people are gathering, so I'll certainly take my time doing this general introduction for you. So good morning and welcome to those of you who are joining us from around Colorado and around the country. My name is Tracy Marshall. I serve as the Division Director for the Paid Family and Medical Leave Program, affectionately known as FAMLI, here at the Colorado Department of Labor and Employment. I'm joined today by several of my colleagues, and you'll be hearing from Rachel McCombs, Adam Siramaco, and Joshua Mayers. Plus, there's also a handful of our colleagues from our policy and communications team. They'll be on hand to answer your questions both live and also in the Q&A function for those of you joining us through Zoom. Before we get started, just a few housekeeping items to go over. So this presentation will be available on family.colorado.gov shortly after the webinar. We'll also share it with everyone who registered with us, and we're also streaming live right now on YouTube. If you're watching from YouTube, please ask your questions in the comments section. If you're joining us from Zoom, please ask your questions in the Q&A function on your Zoom dashboard. The chat function has been disabled on Zoom, but our team of panelists will be sharing helpful links in the chat throughout today's session. We do have a very large audience today, so we already know we will not be able to get to every question, but we will do our very best to get to as many questions as we can, both for those of you in YouTube and those of you joining us on Zoom. So here's a quick look at our agenda for today. We're going to cover a quick overview of the program. We'll let you know how to qualify for family leave. We'll also take a look at the My Family Plus benefits application portal, and that will include information on how to securely verify your identity and also what to expect when you're getting family payments. We will leave as much time as we can at the end for questions and hopefully some good answers for you. So we would be remiss to not start by celebrating that family benefits officially became available to Colorado workers just 1 month ago. Approved claimants were able to start taking their time away from work beginning on January 1st. And so far, we're very proud to say that benefits are going out just as planned. And we've been very pleased with how quickly people are working through the system for such a new program. A quick overview of what FAMLI itself is. So FAMLI provides paid leave for Colorado workers to take care of themselves and their loved ones during certain life events, and we will dive more into those in a moment. FAMLI was approved by Colorado's voters in November 2020 through Proposition 118, and it's known to be a benefit that Colorado workers want. FAMLI program covers almost all workers in Colorado, including those who are self-employed or gig workers, independent contractors, and also employees of opted-out local governments. The FAMLI program is a social insurance program funded by both employers and by employees, but self-employed workers are responsible only for paying the worker premium, which is set at 0.45%. FAMLI participation is entirely optional for those of you who are self-employed and do not employ anybody else. So FAMLI provides that 12 weeks of paid leave for Colorado workers who need time away from work to take care of themselves or to take care of their loved ones. Covered workers are able to apply for paid family leave benefits during certain life events, including managing a serious health condition, taking care of a child that has joined their family, including those who have joined through adoption or foster placement, making arrangements ahead of a loved one's military deployment, and also to deal with the immediate needs and impacts relating from intimate partner violence or sexual assault. Those who experience pregnancy or childbirth complications may be eligible for an additional 4 weeks of leave, giving them a total of 16 weeks of leave if their provider supports this. Family benefits are paid directly from the family division. They are not paid to you by your employer. So let's take a slightly deeper dive into that serious health condition that qualifies someone for family leave. What exactly does that mean? So on this slide, you'll see the definition of a serious health condition and how the law defines it for us. It's an illness, injury, impairment, pregnancy, recovery from childbirth, or a physical or mental condition that involves inpatient care in a hospital, hospice, or residential care facility, or requires continuing treatment by a healthcare provider. Now, the definition for Colorado of healthcare provider, we define that as any person who is licensed, certified, or registered under federal or Colorado law to provide medical or emergency services. So that does include physicians, doctors, nurses, midwives, emergency room personnel, plus others. I'm going to hand you over now to my policy advisor colleague, Adam Siramarco.
Thanks, Tracy. So this next slide, we're going to look at a few examples of what family payments may look like for workers who need to take it. So employees who are covered under the family program can receive a benefit of up to 90% of their wages, but that benefit is based on a sliding scale, and those benefits are capped at $1,100 per week. So you can see based on some of these examples that if you make $2,000 per week, you hit that cap of $1,100. But if your weekly payment is $500 per week, if your average weekly wage is $500 per week, then you get a 90% replacement in terms of the benefit. Keep in mind that the cap is proportional to the average weekly wage for Colorado, and it may well increase over time. We also have a benefit amount calculator on our website to get folks through some rough estimates of what those benefits would be, as well as the deductions that they're likely to see on those paychecks. That calculator is a rough estimate and does not precisely model exactly how the benefits are calculated. Those are done individually when you apply for benefits, but that calculator is a pretty good rough estimate of what you'd receive when you take a family benefit. And as a reminder, premiums are paid based on gross wages up to the federal Social Security wage cap. Keep in mind that this number isn't set in stone, as the federal Social Security cap changes and increases from year to year, so will the family wage cap for premiums. So the next thing that we're going to discuss about family is how a leave can be taken. And the nice thing about family is that leave does not need to be taken all at once. And if we could switch to the next slide, that'd be great.